introduce our speaker tonight. She's going to share the impact that hospice has had on her and her family. And I'd ask Ann Kerkvliet if she would just come up, please, and share her heart.
Well, as Terry said, I'm Ann Kerkvliet, and I was very surprised tonight because I knew that one of my sons would be here, the one that lives in Hutchinson, our youngest son. But our son from Hutchinson showed up, and our son from Fargo showed up, and our son from Baltimore flew in. Wow. So I'll just go on as I was going to. Good evening. My name is Ann Kerkvliet. My husband, Bernie, and I moved to Hutchinson along with our 4 boys, Mark, Gary, Stephen, and Tim, in 1973. The boys were then 11, 10, 7, and 3. All are now married. One lives near Fargo, one in Baltimore, one in Chanhassen, and the youngest one, Tim, lives in Hutchinson. First, I want to thank you for coming to this annual event, the Share and Care Dinner. It's such an important fundraiser for hospice. The funds raised help cover expenses not paid by insurances and Medicare, and help cover many other needs. I would strongly encourage you to invite friends and family not able to come this year, and also those who don't really understand what hospice is all about. Invite them to next year's event. Tell them to come, enjoy a delicious meal, and learn about this wonderful organization known as hospice. The main reason I'm here tonight is to share with you my experience with hospice, both as a hospice volunteer and also one who eventually needed the services of hospice. When I received the call asking me if I would speak about my experience with hospice, I quickly responded yes, as I'm always anxious to speak of hospice to anyone who is willing to listen. I'm very proud to have been associated with hospice in one way or another for the past 27 years. Although now retired, I've been a nurse for over 50 years, so I've been aware of hospice for a long time. I was requested to share my thoughts both as a volunteer providing care and friendship to a client and their family, and for 8 months being on the receiving end of this care. I have spent some time the past few weeks thinking about both sides of the coin, so to speak, and I hope I can share with you what you will find interesting and perhaps even a little bit informative. My initial involvement with the hospice organization began when we moved to Hutchinson in 1973. Wanting to get involved in some volunteer work, I looked through the Hutch Leader and noticed that there were classes scheduled for people who would like to learn about being a hospice volunteer, and I was immediately hooked. I learned so many things at those sessions. First, I learned about what hospice really is and how it got started. I learned about caring, helping, sharing, confidentiality, being a member of a hospice team, the things a volunteer can do to help a family who has someone enrolled in the program. And I learned about how all the team members work together, so every member of the team is aware of the things it is necessary for them to know to function efficiently. I was taught the importance of being a good listener, for it is in listening that we learn. Frequently, the client would tell the volunteer things they won't tell other members of the team. Because as volunteers, we come as a friend. We don't come with any hidden agenda. We aren't going to ask them about gas pains, bowel movements. We're just going to visit with them and to be a friend. Of course, they are in need of information, care, and help. But have you ever stopped to think about what it is to be invited? What a privilege it is to be invited into a stranger's home and be asked to help them live the sunset years of their lives to the fullest, and then help them prepare to go home. Which is the goal of all of us, isn't it? To live every day to the best of our ability, even though that ability becomes diminished at some time in life. The opportunity eventually came up for me to be the coordinator of hospice volunteers. Every member of the hospice team is valuable and needed, but I have a special place in my heart for volunteers. Those I have worked with are the best of the best in helping, caring, sharing, and being a friend. Remember, these people volunteer their time. They're not paid staff. I could relate many instances of where they went above and beyond the expected, but I have a specific instance that I remember so well. It was the 4th of July weekend, and I got the message that they needed 4 volunteers for the weekend. I looked at my list of available people and wondered how I was going to do the impossible. The task of getting 4 volunteers at this late hour for the weekend of the 4th of July. It took me 5 calls to get 4 people to come in. Some who changed their plans so they could help out. The best of the best. In July of 2011, it became necessary for our family to use the receiving end of hospice, as my husband Bernie was diagnosed with ALS, more commonly known as Lou Gehrig's disease. Before we left that fateful visit of diagnosis, one of the last things the doctor said to us was, "I would advise you get in touch with hospice right away." Little did he know, he didn't have to convince me. Upon return home, one of the first steps we took in dealing with this diagnosis was indeed call hospice. I was about to experience firsthand a part of hospice that was strange to me, regardless of my years of association with the hospice team. From the initial visit of enrollment to the moment of death, I could feel the loving arms surrounding Bernie and me and all of our family. Any questions I had, call hospice. When I needed advice or just to talk, call hospice. Equipment needed, call hospice. Medication changes needed, call hospice. Respite care needed, call hospice. Our needs for Bernie and as a family were addressed and handled as quickly as possible and immediately when necessary. One thing I especially appreciated was the fact that although I had worked with the hospice team for many years, they never once assumed that I knew the routine. They explained everything to me, every step along the way, realizing that I was in a much different position this time. During the first hospice visit, the social worker asked Bernie what he most wanted, and he responded, time and to have my pain controlled. Unfortunately, time was not ours to give, so it was shorter than we had hoped. But the nurses were constantly aware of the pain issue and adjusted his medication as needed to keep him relatively pain-free and comfortable, yet alert and able to visit and make his needs known. Because Bernie's pain was well controlled, we had many good times and laughs during these last few months. Our son Gary, who is a physician in Baltimore, took some time off to come home to Helen and to spend time with his dad. One afternoon, Bernie asked to be transferred from his recliner to the wheelchair to go to the bathroom. And Gary jumped up and said, "I'll take care of it. I'll do it." And so he did. Now let's just say Gary is not the most coordinated person in the world. But he tries hard. After the transfers were all finished, Gary said, "Dad, how did I do?" Bernie, humor fully intact, said, "You stepped on my toe." We had a little dog named T-Dip. She was definitely Bernie's dog. And every time the nurse came to take Bernie's blood pressure, T-Dip would put her little paws and nose right up on the recliner to see that nothing was going to happen to Papa. Ne'er a complaint from the nurse, only acceptance and kindness and a couple of pats on the head for T-Dip. Living only 8 months after a diagnosis of ALS is an unusually short time. Because of the care and help of the team of hospice, we were able to make the most of those few sunset months, and we will be eternally grateful for the help that hospice gave us and made that possible. One day I was talking with someone and they asked about what I wanted on my tombstone. With a twinkle in my eye, I said, I want to inscribe, I was a hospice volunteer. I hope to have been able to relate to you our love and appreciation for hospice in general and our wonderful hospice Hutchinson team. Hope, dignity, and love. It must be hospice. Thank you.
Thank you, Mary Ann. And because of your participation here, you have played an active role in supporting hospice and providing that level of care, that experience for the Kerkvliet family, as well as many, many more. And thank you. My hand is off to all of you for supporting hospice for these many years. This is sort of the inaugural event for the foundation. In 1984 it was started. On the back of your bulletin, we're just going to wrap up for the evening. On the back of your program actually shows some people that we want to recognize. I'm not going to list those. You can see by the number of names on this card that there are a tremendous amount of people who are behind this effort and involved in this. We want to recognize some foundation special friends, our annual event sponsors that are listed, our circle of friends, participants, and this year's Hospice Shared Care corporate sponsors. Particularly in light of what was just shared with by Mary Ann, we want to recognize the hospice volunteers. And I wonder if we might just give them a round of applause. I'd like to extend a special thank you to Rachel, my assistant, and to the Hospice Shared Care Committee, who went through a lot of time and effort and work to put out this great event, and also the Hospital Foundation board members, who are, with many of them joining us tonight, who support the organization, give their time and talent to help fund various things in our healthcare need throughout this community in Hutchinson. Again, I can't say enough thank you to all of you for your support. I can't thank you enough, the Kerkvliets, for sharing your heart with us this evening. I hope that maybe some of you have been influenced. Maybe you came here tonight and are prepared to make another donate some money. On the back, on the tables, the stand-up tables, there are some envelopes. If you have a checkbook or some cash and you would like to support hospice, all the funds will go directly to the hospice program. There's no overhead costs or anything associated with that. So we'd encourage you, if you're interested, to make a donation. We encourage you to stay and fellowship, socialize together. Enjoy the rest of your evening. Thank you very much for coming.